Hello, I'm Dr. Gerald Chodak for ProstateVideos.com. In this video, I want to talk about triple drug hormone therapy, which can be used for men with advanced progressive disease, or certainly it can be used for men with earlier stage disease. First, what is it? Well, it involves using three different drugs that have slightly different actions on the body. The first one uses an LHRH agonist or antagonist that blocks the production of testosterone from the testicles. The second drug is called an anti-androgen. It blocks the action of testosterone that comes from the adrenal glands. The third drug is a drug that actually blocks the conversion of testosterone to dihydrotestosterone by prostate cells. It's mainly used to shrink the prostate and to treat men that have prostate enlargement. An idea was suggested several years ago by a Dr. Leibowitz from California that combining the third drug with the other two would have some added advantage for men with this disease. And he published a report back in 2001 on a small number of patients, 110 of them to be exact. They had all stages of disease, and they were treated initially with the three drugs, and after about 12 or 13 months, they were only continued on the drug that was used to shrink the prostate and block the conversion of testosterone to dihydrotestosterone. He had relatively limited follow-up on the entire group, and he reports how few men have progressed. But a major criticism of the study is the fact that most of the men, the majority of the men, had what we consider low-risk prostate cancer. And so we know that unless you look beyond 10 or 12 years, their risk of getting into trouble is extremely low. What this study did not present is much information about treating men with metastatic prostate cancer. And so we have the issue whether or not the addition of this third drug, either finasteride or dutasteride, would add any benefit to men who are going to get combination therapy with an LHRH agonist or antagonist plus an anti-androgen. And all we can say is it probably isn't going to do any significant harm. But whether men need to get it, as suggested by Dr. Leibowitz, is completely unclear. There's been very little follow-up information ever presented since that time. And in fact, there's very little information in the published literature about the effects of finasteride or dutasteride for treating men with prostate cancer, certainly advanced prostate cancer. The side effects of adding the third drug are very small. Most men will already have problems with erections from the other drugs they're taking. So the downside risk is small. The question is whether it adds any benefit. And at this time, the bottom line answer is we have absolutely no idea whether it is worth taking the third drug or not. So it probably doesn't cause much harm, but whether it adds any benefit is unclear. Certainly, it's an option to consider. But no doctor should tell a man, oh, you have to be taking this third drug, that it's definitely going to help you, until we get some kind of good studies that provide us better information. Bottom line is triple drug therapy for using hormones for men with prostate cancer at any stage is an option, but we just can't tell you what to expect in terms of whether it adds significant benefit. I hope you find this information helpful, and thank you for watching.